Donna, welcome. Okay. Hi, everybody. I'm Sammy Kalb-Goldsmit. She said I'm a practicing neurosurgeon in Miami. I apologize in advance. I don't have any fancy presentation or cool videos, but as you will see when you actually become a real doctor, this is something they don't tell you in pre-med or med school. You do not have time. Okay, it's as busy as advertised. We were just talking that actually my Instagram account, it's managed by my PA. She's the one who does all the pictures, all the videos. Because yeah, you have a real job, and anyway, so I do apologize. So I want to talk a little bit about my journey. It's it's a little bit it's a pretty unique journey, I would say, not because it's me, it's because of the path I had to undertake to be where I am. If you haven't noticed, I have an accent. That's because I was born and raised in Mexico City. So yes, I am Mexican, and I went to school in Mexico City. It's called Anáhuac University. It's hard to pronounce, but I always wanted to pursue not only residency, but I always wanted to live and practice in the United States. So I don't know if there's a lot of international graduates in this forum. I believe most of you are in pre-med, so you're in line to go into medical school in the United States. But you probably know that for international graduates pursuing a residency in the United States, it's really hard, especially if you want to be one of the top 5, top 7 most demanded residencies, which it's usually plastic surgery, ENT, neurosurgery, and any surgery really. So my dream was always to become a surgeon, not necessarily a brain surgeon. I actually started medical school, wanted to be a heart surgeon. Um, so I did my medical school in Mexico City, and I was like, okay, so how hard can it be to get into the United States? You do your USMLE boards, you kill them, you get in, right? So I did med school. I finished med school. I finished second in my class, but it's not an Ivy League school. So well, second in your class in Mexico City pretty much doesn't mean anything. When I finished my medical school, if you guys are not familiar, we go straight to graduate school. We don't do undergrad. Pre-med doesn't exist. That only exists here in the United States. So Mexico City is just like Europe or South America. You go straight into medical school, straight out of high school. So I finished medical school and I did my USMLE step 1. Uh, I'll be honest with you, I killed it. I scored a 99 percentile. I did my step 2, killed it too, 99 percentile. I think I scored 268, 269, something like that. I don't even remember. So I went ahead and I applied for, I wanted to be a heart surgeon first. But throughout my last year of medical school, I got involved with a lot of neurosurgeons and a couple of heart surgeons, and they all told me, "You look, there's no future in heart surgery anymore. Everything's done through the catheter, through endovascular." And they were right. I mean, the golden age of the open heart surgery, the triple bypasses, the replacement of the valves. I'm not saying they don't do them anymore, but I mean it's gone down significantly. So at that point I was like, I mean, shit. I mean, do I really want to spend 15 years of my career and then be struggling to find a job? It's one thing that I always, we can talk about that later on about the career path, which I think is very important. So I started spending time with some neurosurgeons, and I ended up loving spine surgery more than anything. So I switched my path. So anyway, I killed my boards. I applied to residency, and surprise, surprise, I got 0 interviews, right? 0 interviews. And I think back then, there were about 100 programs for residency in neurosurgery. There's about 110 now. And I remember borrowing money from my dad, because you probably guys know by now that the more programs you apply, the more expensive it is. And if you did not know about that, newsflash, applying for residency is very expensive. How it works is that you apply to the ERAS program, which is kind of like the match. But you're only allowed to apply, if I recall, sorry, it's been over 10 years ago, to 20 programs for the standard amount of money, which is already a lot. And every program you want to apply after that comes with an additional surcharge. So at one point, I applied to 90% of the programs, and it was a lot of money, and I got 0 interviews. So that was a real eye opener for me. After that was when I really started doing research in how the hell do you get into residency being a foreigner, and not just a foreigner. How do you get into a residency even for a U.S. grad? And that's when I finally realized, and this is 11, 12 years ago, how freaking competitive it was, and it is. I mean, nowadays, I feel bad for you guys, because nowadays it is so competitive. I mean, your guys's your applications, your CVs are out of this world. So 11 years ago, no, I didn't get a single interview. So then I started doing some research. I got in contact with people in the United States, and I was like, shit, I mean, I'm way behind the curve. So, then I realized that, you got to do research. You gotta do rotations. You gotta do all the things that your typical 4th-year medical student does, plus more, right? Because I'm a foreign grad. I went to a medical school that nobody can even pronounce. It's that bad. Anyhow, so one day, so as I am still making up my mind, should I go to the United States or just stay in Mexico? We have residencies in Mexico. We have good doctors in Mexico, and I can tell you that my medical school, they did a fantastic job. I know my shit, okay? But when it comes to training residents, nobody comes close to the United States. This is by far the best specialized country in the world. So I was still committed. I wanted to come here. So I ended up working for a neurosurgeon in Mexico who had ties with a place called Barrow Neurological Institute. Back then, I had no idea what this Barrow Neurological Institute is. But I knew there was this neurosurgeon working in Mexico who had ties with a neurosurgical department in the United States. So I looked him up, and I met up with him briefly, and he actually offered me a job. He told me, look, Sammy, while you're in the process of reapplying, because, why don't you come work with me as my assistant? And I was like, oh, great, sure. So, and during that time, I was studying for my second part of the step 2, because as you know, there's step 1, step 2, and step 3. Step 1 is a written exam. Step 2 is a written exam and an oral exam. And step 3 is a written exam. But as a foreigner, they always encourage you to present step 1 and both steps 2 to have any chance of getting anywhere. I mean, family medicine, psychiatry, and no disrespect if anybody wants to go into those fields, but they're not that hard. I mean, those are not as competitive to get in. Anyway, so as I'm working with this doctor, and by the way, he is like the neurosurgeon in Mexico City. He's at the main private hospital. A certain patient, I'm not gonna say the name because HIPAA violation, comes into the ER, and this person happens to be the brother of the richest man in the world back then. So if you guys want to Google richest man in the world 11 years ago, you're gonna see who I'm talking about, and he's Mexican. So the richest man in the world back then, no, it's not Bezos. Amazon was nothing back then. It wasn't Bill Gates. It was this person. His brother comes in and he has a spine problem. So they called the neurosurgeon that I was. I was shadowing him. I wasn't not really working. I was shadowing him. So they call him up. He's like, look, super VIP, doesn't as VIP as they come. Has this problem. He's in the ER. Can you come see him? So he comes see him, and he asked me, hey, Sammy, your English is really good. His English is not great. Why don't you come with us and help us translate? Because this, I'm thinking of sending him over to the BNI, the Barrel Institute. I was like, well, what's so big deal about this place? Well, it happens to be the best place for neurosurgery in the US. So he tells me, why don't you come help me? Because I'm gonna see him, but given that he's the brother of the richest man in the world, why don't we send him over? Why don't you help us translate so we can get him over there, because they're interested in having he needs a surgery, and they don't want to have surgery in Mexico City, obviously. They want to go to the best. That's what rich people do. And I want you to help us translate. So I go there. And long story short, I help with the translation between Mexico and in this place called the Neuro-Spine Surgery that I've never heard of. And again, long story short, the head of the department, the chief of spine of Neuro-Spine Institute, flies over to Mexico in a private jet owned by the brother. And I meet this famous surgeon in Mexico City, because when you're that rich, you can get away with everything. So I meet him as I'm the translator, and we hit it off. So we started talking. His name is Nicholas Theodore, and just to give you a little heads up of who he is the current chair at Johns Hopkins, and he is currently the chair of the NFL concussion department. So that's him. So he's a big deal. So anyway, I had no clue who he was. We hit it off, and he told me, hey, Sammy, so I hear you want to be a neurosurgeon in the United States. I was like, yeah, well, I know, but, can you help me? I was like, well, why don't you come and do a little tryout, do some research for me in my lab? I'm like, well, okay, sure, why not? I had nothing to lose at that point. So packed my bags, sold everything I had, sold my car, and I took a plane to Phoenix, Arizona. The only thing I knew about the Phoenix was that they had a football team called the Cardinals. I'm a Cowboys fan, so we always play the Cardinals, and they have a basketball team called the Phoenix Suns. That's all I knew about Phoenix. So I packed up, went to Phoenix, and I started doing research for Nicholas Theodore. You just, if you really want it, you work your ass off. And I started publishing like crazy. I got articles published in the main journals of neurosurgery, the main journals of spine surgery. And next thing you know, he offers me a fellowship, a research fellowship, kind of like a master's, which is a combination between Barrow and ASU. So of course I accept that fellowship. So I do research for 2 years, and 2 years later, I decided to apply to neurosurgery residency again. And for those again who are just joining, not familiar, for anybody getting into one of these residencies, you know how hard it is. As a foreigner, it's even harder. The odds of matching as a foreigner in any surgery subspecialty is less than 5%. The odds of matching in neurosurgery is less than 1%. Barrow Neurological Institute had never had a foreigner ever in their program. 2 years later, I become the first ever foreigner to match at the Barrow Neurological Institute. I call it luck. Yes, I worked my ass off. By the time I applied, I had 30 published peer-reviewed articles. I had over 60 poster and oral presentations, and I had about 5 or 6 book chapters, but book chapters really don't matter. So yes, I worked hard. I got lucky, and I ended up matching at the top ranked neurosurgery program in the country. Uh, Spent 7 years there, and then what did I do that? Just ignore that. And then afterwards, I applied for the fellowship at Johns Hopkins, because it's the Johns Hopkins. So they were starting a program on robotic spine surgeries. Uh, we now have a robot to do spine surgery, and they are the pioneers. So I decided to join them for a year to get familiar with the robot, and Johns Hopkins. The name doesn't hurt. So I ended up doing my fellowship there. Finished my fellowship, and then I started looking for a job. And I was blessed to be recruited here at Mount Sinai, Florida, Miami Beach. I wish I could show you guys the view from my apartment, but I have a view of the water. You can't beat this. So I am living proof that the American dream does exist, and that if you work hard and you're dedicated, and and you really put your mind and set to it, you can really accomplish everything you want. But I also had a crude opening of how difficult things are. I was also part of the matching process in my own residency. I was the chief resident also in my program, so I was responsible for matching in neurosurgery. So uh, I don't know if there's any questions that can come up about the matching process. I understand that most of my viewers today are in pre-med, not in med school, so probably matching is a little bit far out, or way ahead of where you are right now. But I think that medicine is becoming so competitive. I mean, just getting into medical school in this country is so hard. So then you have to go into medical school, and then getting into a good residency is just so hard. But you guys are so well prepared that I think there's a lot of things that you guys need to know, and I can probably help with that, uh, because nobody really prepares you for this. And then when you come to where I'm at, so I'm in my second year of practice. I joined the practice of 5 physicians. Well, there were 4. I was number 5. They brought me in to do what we call complex spine surgery, which is all the crazy spine that nobody wants to deal with. Scoliosis, for example. My specialty, which is revision spine surgery. What that means is that I pretty much fix up other people's screw ups. I'm gonna call it that way. Um, and there's it's a real eye opener, because again, you're busier than when you expect. I mean, I don't even have time to make a PowerPoint presentation. But at the same time, I can tell you that I wouldn't change a thing of my life. I love my life, but it's hard. Residency took a toll on me. I mean, I lost hair. I mean, God bless my girlfriend that she still loves me even though I'm losing hair. But I had a full hair before residency, and the stress is real. I mean, it's real. I mean, it's got to the point that my girlfriend's telling me, "Hey, are you doing okay?" Like, well, no, because it's the stress is real, and nobody prepares you for that. Nobody in college, nobody in medical school, nobody in residency they're not going to prepare you for 2 things. One, the level of stress and work hours that you're going to have to put in. People always talk about, oh, residency. Residency is super hard. The hours are crazy. Guess what? I think I'm working more hours now than I was working in residency. And the other thing is the financial part of medicine. I could tell you that half of the people I know that fail in their first years after residency, when you're already a real doctor, is because of poor financial decisions. And that's something that I take pride on, because since day one, I was heavily involved in the financial or economical side of medicine. Because yes, we do this because we love it. And I can tell you right now, to all of you who think are going into this because you want to make money, and you've heard this a million times, well, I'm going to be a million and one. Get out of here, because you're not. Look, the money is good, yes, but it's going to take you 15, 16 years to be able to make a penny, and you're gonna have to earn that penny. But having said that, you have to make smart financial decisions, right? Nobody prepares you for that. You have to know what kind of job to look for, or even what kind of specialty, because again, my heart goes out to all those that want to be OB-GYNs or pediatricians. This world needs more of you, but unfortunately the reimbursements and the pay is so low that nobody wants to go into those fields anymore. And you got to think, you got to think about your career, your medical career, as one, what do you love, what do you want to do, what do you think you're good at? That's the other thing. Look, if you're not good with your hands, don't be a surgeon, right? Please don't be a surgeon. Or if you don't have good memory, uh, you know, don't be an internist, because you have to memorize a lot of things. You have to know what you're good for, but at the same time, you have to understand that this is your business. So you have to be smart about that. And at the student loans to that, the last thing you want at my level, being 2 years out, is to have a financial burden. So you want to be smart about that. So I've been blessed by finding the perfect job. I mean, I took a big risk. Sorry, I'm coming out of a cold last week, COVID negative. I took a big risk of taking a job in one of the most competitive cities in the country, which is Miami. It's always California, New York, Boston, and Miami. Those are the toughest markets, and I decided to, go headfront to one of the toughest markets. But I was blessed to find a great job, and I'm very proud to say that last year I was the second busiest spine surgeon in Miami, because there's metrics that you can follow. There's something called the Medicare metrics, where people can see your productivity. It's open, it's public. And as of this year, even with COVID, I am the single busiest spine surgeon in all Miami. Um, this was not something that I did on my own. This is something that I have to give credit to my amazing team at Mount Sinai. The opportunity I was given, it was just the right fit at the right time. Um, I'm averaging, or I was averaging, about 25 to 30 surgeries a month. And this is private practice. Okay. Mount Sinai is a private practice hospital. So that means I don't have a university. I don't have residents. So that's another type of big decision that I think you guys are probably still too young to make. But I always knew that I wanted to go into private practice. But some people like to teach. They like to have students. They like to be more involved in academia. Again, if you look me up, I have about 40 plus peer-reviewed articles. So I did my fair share of research. And now my decision was more of quality of life. Want to do my job, and then I want to come home and spend time with my girlfriend and my dog and enjoy life. But that's my decision. But before COVID, I was averaging close to 30 surgeries a month. Of course, with COVID, that went down. Right now, I'm about 20, 22 surgeries a month, which I could never imagine being in this situation. But it's just it's the reflection of hard work, and That's why I love reaching out to young people. I actually was I was on the phone a couple of weeks ago with a pre-med student. He's in New York. He's in Cornell, and because he looked me up on Instagram, and I get a lot of these kind of phone calls, a lot from students in Mexico City, from my med school that reach out to me. But they reach out to me because nobody was there for me when I needed guidance. Nobody told me, hey, you need to do this, this, and that to get into residency, for example. And I wasted probably a year and a half. Somebody would have told me, or guided me, things would have been easier. Journey, and I'm more than happy to take any questions.
Thank you so much for that. Your story was very inspiring, and everyone in the chat is very thankful for keeping it real, kind of telling us the not so glamorous parts. There are several international students in the audience today, so
oh great.
There were some people who were really happy with the suggestions and advice you gave. So there were some people asking how, for these international students, how did you manage to, other than being number 2 in your medical school, but how else do you manage to stand out when applying to US schools for residency, fellowship?
Yeah, absolutely. So being 2 in my medical school means squat. They couldn't even pronounce my medical school. So for those in IMGs out there, first of all, look, it's hard. Don't give up. I mean, I'm living proof that you can get into any residency. Even the residencies that they say that they don't take international graduates, that's bullshit. Okay, because the Bureau never took international graduates, and I broke in. There's always a first, right? But for us, it's harder. So this is what you need to do. First of all, you need to have great board scores. But that's all of you guys. IMG or not IMG, it's so competitive right now that your board scores have to be out of this world just to get into a good competitive program. But for IMGs in particular, you need a lot of research. Okay, and the ratio that I like to use is 3-to-1. For every one publication that your counter American grad has, you need 3. If they are applying with 10 articles, you need 30. If they're applying with 10 posters, you need 30. Okay, so it's going to take time. It's going to take effort. It took me 3 years to get into residency between medical school and residency. 3 years. So a lot of publications, a lot of research. You have to go to the meetings, and the single most important thing, unfortunately, is who you know. You need to find that person who is a figure in whichever area you're interested in. You need to find, who is the main guy in pediatrician, who's the main heart surgeon, who's the main cardiologist, and you have to go and spend time with him or his department, because at the end of the day, you're going to need them to back you up. You're going to need a really good letter of recommendation from a person who's really, really, really high up in the ladder. Like for me, it was Dr. Nicholas Theodore, same guy. When I applied for residency, he is the one who picked up the phone and told them, Sammy is my guy. I back him up. You need to take him. So you need to find that person in your area that earns your trust, and at the end of the day is going to give you a badass letter of recommendation, and who is going to be willing to back you up. So those 3 things: you need killer board scores, tons of research, and somebody to back you up.
Great, thank you for that. Kind of going off of, you mentioned you have to have really good scores no matter what. What kind of advice do you have for study tips, like through medical school, for your USMLE, just really any test that you're going to take as an aspiring physician?
The problem is, you guys know it's how testing is. You memorize everything and you just show up. Now, there's some people who are naturally good at tests. I can tell you when I was part of the board committee for application, and the way we did our interviews. So first of all, you have to understand we get 500 applications for residency. And this is neurosurgery. Imagine internal medicine, they probably get 5,000 or 6,000 per program. So they have to triage. So the way they triage, number one, and this is everywhere because I've talked to friends who are in all fields. The number one thing that they're going to look at is your step one. So step one board score is your number one triage. So it depends what specialty and what program they have a cutoff. In my program, the cutoff was for step one was 255. Okay, what is that? For you guys who know what 255 means, it's really high. Just to give you an idea, the top score, the root is 280. That's the top, unless things have changed. So that means, I mean, you really you really can only have 10% wrong answers. So it's that competitive. Now, that's neurosurgery, that's dermatologist, for example, that's ENT, pediatrics, OB-GYN, psychiatry, those specialties that have, it's not that I'm saying it's easier to get in, you just have more residency positions, right? Internal medicine has 8,000-9,000. Neurosurgery has 200. Dermatology has like 50. So that's why it's easier. So those kinds of residencies, I know that if you score a 200, you already made the cut. So that's number one. So step one is the first thing. The second thing that they're going to look at is your school. So this is where what school you went to matters. No, unfortunately. Two, your grades. And three is any extracurricular activity that you've done. You guys have to understand how competitive it is. I remember this was 5 years ago. When I was looking at the current applicants for residency, I looked at myself in the mirror like I would have never matched. I mean, these guys had, their applications were out of this world, and it's just getting more and more and more competitive. The extracurricular activity that these guys were doing was insane. So that's the kind of things they do. They want to know what makes you different than the other 3,000 who scored the same as you. What makes you different than the other 3,000 that went to Cornell, Columbia, Harvard, Yale? I can keep going on and on and on. So you really have to have something that makes you stand out, and that's where it gets really tricky. Really competitive. And then the last thing is letters of recommendation. We take that very, very serious. I remember that I particularly chose several people based only on the letter of recommendation. And what matters is who did the letter and does the letter look generic or not. And you guys know that it's very easy to know when a letter looks generic. When you went to the president of Yale Medical and he gave you a letter, a generic letter, it's very obvious, but when you go to the same person and, you can see that it's personalized, you're like, holy shit, this guy must be really, or this girl must be really, really good because this person went, beyond to do a letter of recommendation. So that's really what they're looking at.
Great, thank you so much. I don't know if you know this, but actually step one is moving to a pass or fail basis as of the next cycle.
I did not know that. No.
Yeah, so there's a lot of talk in the chat about that, which pros and cons to that. But that was
I think it's a good thing. It's just going to be like pass or fail.
Yeah, it's pass or fail, which I think like some people were saying that like there's pros of it because you either pass or you fail, there's less stress.
Yeah.
But the cons are definitely because a lot of residency programs would look at your step 1 score. So now it's kind of like, how are you going to stand out? And so, yeah, I guess we'll see the ramifications of that.
Yeah, I see it as something good, because I am one of those who is a strong believer that a test means nothing, right? There's a lot of people who are really good at tests. They score, they have the perfect scores, and they are. I mean, I wouldn't even send my neighbor's dog to them to get treated. They're that bad. Okay. So I think by eliminating this test as a triage and probably focusing more on what the person has done throughout his career, if you ask me, I see it as something good.
Yeah, definitely pros and cons. So I think now moving towards more of your neurosurgery profession. So there's people asking, so you specialize in spine surgery.
Correct.
And so, those cases, I think there's a lot of people wondering how long, because when you see it on TV, you see these like grueling 12-hour surgeries. So how long, what does a typical day look like for you? Do you do clinic surgery? Are you on your feet a lot? Does that take a toll on your body? If you could speak kind of on
that. Yes, a huge toll on my body. Yes. So spine surgery. So first of all, I'm a neurosurgeon first. So actually, if you go into the Instagram that my PA did for me, you'll see a couple of brain cases, because I do take call. And whenever a brain case comes in, trauma, for example, a subdural hematoma, an epidural hematoma, a brain tumor, I still love brain surgery. The things I don't like, for example, I don't like aneurysms. I don't like clipping aneurysms. I don't like doing bypasses. I don't like doing 20-hour big brain, open brain tumors. No, I don't enjoy that. But I still love and enjoy the brain. So my current practice is about 90% spine and 10% brain. So my typical week now is because I have so many booked surgeries. I first started with 4 days of clinic, which is where you see the patients in the office, your typical office visit, and 1 day of surgery. But nowadays I'm so busy that I'm doing 3 days of surgery. So I do Monday, Wednesday, and Friday surgery, because I just cannot keep up. And I do clinic Tuesdays and Thursdays. Yes. Your spine surgery can range from 30 minutes to 8 hours, depending what you do. For example, tomorrow, I have 2 surgeries. I have 2 disc herniations. What is that? In the spine, we have the vertebral bones. We have 31 vertebral bones, and in between bone and bone, we have a little cushion that's called the disc. And sometimes a little piece of the disc, spits out and it pushes on the nerve, and that's the classic herniated disc. Okay. That surgery takes me about 40 minutes, 35, 40 minutes. So I have 2 of those tomorrow. So tomorrow's a really nice Friday. I have 2 of those, takes me 40 minutes. I'll probably be home by 1 o'clock. But my average day, I do bigger operations. Again, I specialize in more complicated spine surgery, revision spine surgery, deformity surgery. Those cases are big. Wednesdays is my day that I do deformity. My average case is about 6 to 8 hours. Am I on my feet the whole time? No. Usually you're operating for about 2 to 3 hours. Then it's not that you take a break, but sometimes you have to reposition the patient, and you can have lunch, you can go to the bathroom. But you never, at least I don't operate 8 hours straight. Spine surgery has changed a lot. It's advanced a lot. As I said, we're using robots now. So what does that mean? That spine surgery is quicker. Your average big scoliosis surgery that used to take 12, 14 hours, now it can take me about 6 hours. Your average one segment, small lumbar fusion used to take, well, it can still take some surgeons 5, 6 hours. With the current technology, it takes me about 90 minutes or less. So I can do 2, 3, sometimes even 4 surgeries in one day. I can still be home by 6 o'clock. Now, does it take a big toll on my body? Yes, I'm exhausted. Spine and orthopedic surgery are the two specialties that take a huge toll on your body. My hands hurt. Yes, on the weekends, I put my hands into some little mittens that I heat up. My girlfriend massages my hands because they hurt. So I would say that's kind of my typical day, my typical average operations.
Okay, so it's not as glamorous as we all see on TV.
It is glamorous, but it's funny because what's Lennox Hill? Lennox Hill. You guys, I'm sure a lot of you guys saw Lennox Hill. My partner did his residency with what's his name? There's two main guys. The young
Was
one.
it Bakvar?
Yeah, with Butler. They did residency together. They were residents together. So they know each other really well. And I watched that show with my girlfriend, and it's funny to me because it's out of proportion, guys. That's not how it is. We don't pray before an operation. We don't plan 3 weeks ahead. That's not how it is. Okay, it's no, things move really, really, really fast. You do 2 to 3 surgeries in one day, and you have, in any given time, you have 15, 20 people admitted in the hospital as well. Because, there's sick people still. You have people with strokes. You have people with brain bleeds. You have people with hydrocephalus. You have people with back pain, with fractures that you still have to take care of. So, no, that's TV. That's not how it really is. It's a way faster pace than that.
Great. Thank you so much for clarifying that for us. So there were some questions asking about how often you collaborate with other specialties. How often are you in the operating room with someone who's not a spine surgeon, or is it just you?
Okay. We do collaborate. I would say the people we collaborate the most are plastic surgeons, and ENTs. I just did a case yesterday with a plastic surgeon, a person that needed a reconstruction of their skull. So I did the skull part, the brain part, and the plastic surgeon did the skin and the closure. So we do collaborate. I would say I do maybe 1 or 2, no, probably 1 a month. But if you go to a university setting, it's way more than that with plastic surgeons. With ENTs, we also collaborate at all when we do big tumors, especially of the neck, or what we call the base of the skull. We take advantage of them to do the approach for us because they're better at that for us. And then they do the approach, we remove the tumor, and then they close up. And then in the spine world, I actually collaborate with a vascular surgeon because I do spine surgery from the front and from the side. When I do surgery from the front, I have a vascular surgeon who does the approach for me. He does a small, about 3-inch incision in the abdomen. He moves all the intra-abdominal content towards the side. He moves the branch of the iliac vein in the iliac artery either to the side or enough for me so I can see the spine, and then I do the spine operation. So we do collaborate at all, but I would say 90% of the time it's me and my assistant.
Okay, thank you for answering that. There were several students wondering just on the topic of research, and not only like do you yourself still do research as you're practicing, but also what are the possibilities of being a full-time neurosurgeon, spine surgeon, and also saving time for research if you would want to?
Okay. So I decided that I did enough research for a lifetime. Again, I think I had like 40 articles, and I still have a couple that I did while I was at Johns Hopkins that I started or I was part of it, and they're still ongoing. But I decided to do a private practice life. Private practice pretty much means you don't want to do research. Okay. If you want to do research, you want to find a career in a university setting where you have residence, where you have a medical school tied to it, or even if you don't have residence, you can still do research, but as long as you have a university attached to it. As long as you are in a university setting, you can be a clinician and you can be a researcher. They're not opposites. You can do both, and you can do both in a very successful way. But you just have to be in the right environment. Yeah, it has to be a university setting. Same goes for brain surgery. If you can be in a university setting that has great labs, for example, and be a practitioner as well. So it's very, very doable.
Great, thank you for that insight. There was a question asking about just robotics and technology. I mean, minimally invasive surgery has its own fellowship now. So what do you feel, or how often do you, particularly as a neurosurgeon, spine surgeon, use robotics? Are you still mainly working like with your hands, or is it mainly transitioning? Is it half and half? If you could kind of talk on that.
So to be a minimal invasive spine surgeon, you do have to do a fellowship. Even though depending on what residency you do, they may train you enough to do minimal invasive, but you need a fellowship. When it comes to robotics, there are two main robots in the market right now. One's called the Excelsius GPS, the other one's called the Mazor. Those are the two more popular spine robots out there. I've been trained to do both. The reality is that it's in its beginnings. In my case, I stopped using the robot because it was slowing me down. My surgeries went from an hour, hour and a half to 3 hours using the robot. So I decided not to use it. However, I do use a computer, and I use software to do all my surgeries. We use what's called navigation, which is a fancy word of saying a GPS of your spine. So what we do is that while the patient is laying flat, we take a CAT scan, we take that information, we plug it into the computer, and that computer tells me live information of the patient's anatomy. So using this computer, I do my operation with precise, accuracy and minimizing any kind of error. But it's gaining traction. The Da Vinci was the first big robot out there, and of course, it's if you ask me if it's the future, I don't know. There's a big problem with neurosurgery and robots, and this goes to the FDA. The FDA will not allow a robot to be close to a vital structure, and by that is heart, brain, or nerves. That's why these robots will, at least for now, they won't be allowed to do a full spinal operation, but it's definitely the future. Again, I stopped using it, but I do use technology that's similar to the robot, and it's all based on computer and software.
Okay, thank you for that. There were some questions asking about the mortality rate, or even just like back to normal functioning after spine surgery, brain surgery. In the media, it's kind of played up about losing function and high risk. And so what is the actual reality of brain surgery, spine surgery?
So brain surgery is a little bit tricky because it depends what the diagnosis is, right? You probably guys heard if you have brain cancer, a brain tumor, Now, prognosis is really bad. Now, the most common brain cancer, well, number one is metastases, which is cancer from somewhere else in the body that goes to the brain. And usually when it goes to the brain, that means it's stage 4. So that's, bad news bears. And then the most common primary tumor of the brain is what we call glioblastoma, or GBM. And it's arguably the most malignant cancer that we know of. We can do surgery, we can do chemo, we can do radiation therapy, and still the 5-year survival rate is less than 5%. So it's hard to tell you what the survival rate for brain surgery is, because the diagnosis is so broad. On the other hand, if you have a benign tumor like a meningioma, the survival rate is 100%. If you have, for example, a trauma or in a subdural hematoma, survival rate is 100%. So the brain is kind of tricky. When it comes to the spine, unfortunately, my lovely spine has so much bad reputation. My goodness, there's so much taboo out there. My patients come up to me, and when I tell them, hey, you need spine surgery, they're like, oh, they're like kind of spitting on me. They're like, what are you talking about? I mean, they think they're going to go paralyzed. And the reality is that spine surgery is now the second most common surgery in the whole country. So if the outcomes would be that bad, it wouldn't be that popular. Second of all, what I tell my patients that if spine surgery is that bad and the outcomes are so bad, then why does insurance approve it? Spine surgery is the single most expensive surgery in the whole medical field. Okay, your average spine surgery that requires instrumentation, which means screws, rods, spacers, it's about $60,000. That's just the average. Okay, so if it was that bad, insurances would not approve it. So the reality is that spine surgery nowadays has advanced probably more than any other field. Our outcomes are amazing. Our complication rates are less than 5%, and our outcomes are getting better and better. And it's all about the techniques, it's all about the technology. But again, before COVID, I was doing close to 30 surgeries a month. And people, I'm not going to say everybody's happy. No. My experience and talking to my colleagues is that 80% of the people that have spine surgery are extremely happy. 20% are not happy at all. And trust me, they come to my office and they let me know how unhappy they are. But 80%, so that's huge.
Great, thank you. I didn't know that spinal surgery was the second most popular. So
number 2 now. Heart is number 1, and heart is still number 1. Spine surgery is number 2.
Wow, that's cool. Didn't know that. So we'll do one more question here before we wrap it up. Okay. There were some questions about the pediatric population and how, I mean, personally, how often you treat pediatrics, but also do you have to have a special fellowship to do pediatric spine surgery, or if you could talk on that a little bit?
So yes, you have to be a fellowship trained pediatric. I don't do pediatrics because I can't. Technically, I can't. During residency, you do see pediatric, but it's very limited. In my residency, we only did 6 months of pediatric neurosurgery. I cannot speak on behalf of other programs, but it's very limited. You have to do a fellowship, and it's minimum of 1 year to be able to do pediatric neurosurgery. And usually people who do pediatrics don't do adults, and vice versa. You pretty much commit yourself at working at a children's hospital for the rest of your career. And it's mostly brain, right? I mean, kids usually don't have back pain, or they shouldn't have back pain. So you're basically treating kids with congenital problems, birth problems, hydrocephalus, unfortunately a lot of tumors. So, but you have to be fellowship trained.
Okay, thank you. So I guess we're gonna wrap it up here. So the final question that I have for you is, what advice would you leave us pre-med students with, college pre-med students, especially now with COVID going on? What would you say to us to just kind of inspire us to keep going?
It's a hard road. It's tough, but it's worth it. I couldn't see myself doing anything else, even though I'm exhausted every night. I'm 37 and I go to bed at 9:30. I don't go out to clubs, not because I don't want to, because I'm physically exhausted. You know, I missed out on probably every single one of my friends' weddings, anniversaries, you know, birth of their child, you know, being in the hospital, but it's worth it.
Great. Thank you so much. I don't know if you can see the chat, but if you
No,
want to open it up, there's a lot of
Right.
praise and thanks for you, and thank you for your brutally honest words and
Brutal
your
honest.
advice. We
It's,
really,
yeah,
really appreciate you, and thank you so much for taking time out of your busy, busy schedule to come speak to us.
you're welcome, guys. My pleasure. Bye.
And then I'll put your Instagram handle down in the chat one more time.
Okay.
So if people wanted, there are some questions asking, so I'll go ahead and do that.
Yeah, you'll see my Dana, that's my PA. She does a great job. She picks up my interesting cases and does videos. We put rap on Fridays. I do hip hop on Fridays. So I choose the music. Of course, I'm the surgeon, and each day I choose a different type of music. But Fridays is always hip hop.
Yes, you guys make sure to go look at his Instagram. There's some really cool videos and pictures. But thank you so much. We hope you have a great rest of your night and a great weekend.
You're welcome. Bye, guys.
Thank you. Bye. Good night.